Okay. Good morning. We are going to talk about the Peds today. It's a very long chapter. We have a lot of things to cover in Peds. And this is the package you have. We have one package of Peds with all the notes you have. And it's very good information. We got to know a lot of things. I'm going to start with the diseases. And later on, at the end, you have some growth and development part and a lot of diseases, and we all need to know on that. Then you guys have two part of question, 13 and 14. All the questions I've been giving you out, these are from Lipin card. So please do them and check the answers with me. I have all the answers. So, and I'm not looking how you're doing. Even you miss some questions, that's fine, but we got to do it. So I will start with the Peds. On the page, first page is cleft lip and cleft palate. So I will be talking a lot of diseases in the children, a little bit different. And so we need to know the cleft lip and the cleft palates. The babies are born with lip problem, and it's congenital defect. In the second line, we have cleft lip repair is done from 1 to 3 months. That's important. So underline the wording 1 to 3 months. Why? Because the lip is the problem with sucking with the milk, and baby would have problem in getting the enough formulas or the breastfeeding. So cleft lip repair is done between 1 to 3 months. Sometimes they might say 6 to 12 weeks. That's okay. Very early. And one of the reasons is repair, heals early, scarring is better. And what kind of suture they put it on is, I want you to add their Z-shaped. And on the cleft lip, they put the Z-shaped suture. Z-shaped suture when they're doing the cleft lip repair. And also minimize scarring. The purpose is to do is minimize scarring, and the repair is done early. Cleft palate repair is done from 6 months to 2 years of age. And the main problem here with palate would be, it can affect is hearing, the speech is very important, and infection. So I want you to add on the side. Anytime you're looking, the child is born, they can have problem with the palate, would be speech problem, infection problem, and also it can affect the hearing with the child. And so that is why its repair is done before the child's develop their speech. The palate repair is done. Now, pre-op care is on cleft lip. Babies are very important, the feeding. There may be a special feeder, brick feeder, we have in the notes there. Maybe a special nipple, maybe a soft nipple, maybe a large hole. Anything for you guys, anything in the questions is important that you see that something soft, the baby is able to do it. And the large hole also, because they can swallow easily. Very important that you feed the baby very slowly. And what do you do after you feed is burping. And the next line, very important word, what do you prevent here? Aspiration. Everyone is okay? Swallowing is important, aspiration is important, and what do you keep available in the room are bulb syringe or suction. Bulb syringe, if they aspirate, so you can suction the baby. So that would be on cleft lip, baby's repair. Enlarged nipple, you have ESSR word. E means enlarged nipple, S means stimulate, S is sucking reflexes and swallowing, and next is rest. Allow the rest in between the baby's feeding. So remember that word can be used. After the child come back from repair, cleft lip, what do we do as a nurse is number one is preventing the pressure on the suture line. So post-op, highlight the word suture line, because what happened with the suture line, there would be a stress. And what do you prevent sometime in your question? What is your priority? Babies are born with cleft lip after the repair. Prevent the pressure on the suture line. And how do you prevent? Write down the word prevent crying. Number one, hold the baby. And what happens if they cry more is going to open it up. But they can also use, is called the word Logan bar or Logan bow. And what is Logan bar and bow are? They're like a clip on the lips. And what is it? To keeping the sutures together. So Logan bar and Logan bow prevent crying as a prevention, but also putting the clip on their lips. And why? So when they're crying, the sutures will not open. So number one priority is the suture. And what position do you put the baby? Second line, back. On feeding, you can put on the back, or maybe putting on their back or using their positioning properly. And if you are turning them, what side would you turn them? Is unaffected side. Don't lay the baby with the same side where they have suture, because what happens, they can rub and it can cause infection and it can open it up. So if you are turning them, turn them on the unaffected side. So you have on the second line, position is best on unaffected side or on the back. Are we clear? Upright position, back position would be good. Next thing is important, the suture line. On the third line, we have suture line. What do you do for suture line? Is clean them after each feeding. And how? You can use normal saline and you can use hydrogen peroxide. If you're using hydrogen peroxide, we should use it half and half. Half water, because it's very strong. So it says half strength of hydrogen peroxide. So that will go on cleaning. So very important is, again, prevent aspiration is important, prevent crying, cleaning of the suture line. Now the next is cleft palate babies. The repair is done on cleft palate. The best is to put them on the stomach and or on the side position. Why? You want to prevent them from aspiration. Are we clear? So we all know the palate is inside, and if you suction frequently, you can hurt them and it can cause more problems. So you are preventing them from aspiration, putting them on the stomach, on the prawn position, or on the sideline position would be good. Feeding. Now because the babies are older now, you can use maybe a cup to feed them. And next is, after feeding, you may use the water. Why? Because you want to wash the mouth and the palate after the feeding to prevent infection. Packing. Number 4, packing, if they have it, would be removed 2 to 3 days. Restraints for cleft lip and cleft palate, both are restraints for babies are elbow restraints. So highlight that word, elbow restraints, and you remember for cleft lip babies also, if you're using, you can go for elbow restraints. Avoid suctioning and avoid tongue depressors. Avoid using a straw, pacifier, sharp object. And number 7, by the time if you're giving any food, any hard cookies, toast, avoid them, because that can cause pain and it can hurt them. So that's important. And after the repair is done, maybe they can refer to orthodontist and for the speech to see the child is okay and that repair is done. So everyone remember is when the child is not able to take enough feeding, it's very important that you are preventing them from aspiration and also keeping the suture line from preventing infection. The second one, I'm going to go esophageal atresia or tracheoesophageal fistula. Very important that there are 2 wording. And what happened, the esophagus, when you are feeding the baby or when we are eating food, what happened? The food is going from, or when you feed the baby, the milk is going from esophagus to the stomach. But what happened, there is a problem in esophagus, and that the word we have is it's not complete opening in esophagus is called atresia, and second word is called fistula. So let's see, what is that atresia and fistula? Underline the word atresia means failure of the esophagus to develop continuous passage. That means it's not open completely and the milk is not going in the stomach. Everyone is okay? Atresia means is not complete passage, maybe a narrowing, closing, and the baby, when you're feeding them, the milk is not going in the stomach. Are we clear? Number 2, when we use the word fistula, tracheoesophageal, so what happened? Abnormal opening between esophagus and trachea. So where is the milk is going now? In the trachea. And where is trachea is part of your respiratory system. So where is the milk is going to go now? In the lungs. Everyone is okay? What do you do for the child who is having esophageal atresia and tracheoesophageal fistula? Now everyone should know there are 3 signs are here, which is called 3 C's: choking, coughing, and cyanosis. So what are the 3 C's are? Coughing, choking, and cyanosis. And during, remember the word, underline the word feeding, not sleeping, not during playing. Only when you're feeding the baby, what do we see here? Choking, coughing, and cyanosis. And the next word is, underline the word drooling. Now some of your question may be 4 C's, and in the 4 C's they have added continuous drooling. Are we clear? So maybe the 4 C if you have continuous drooling. But 3 C's means is baby is having coughing, choking, and cyanosis. And when do you feel those 3 wording are when you are feeding the baby? And drooling continuously. Because they are swallowing a lot of air, underline the word, they have abdominal distension. What do they have here? Abdominal distension. Pre-op care. What do you do if you have a baby and the feeding is not going into the stomach? What do you prevent the baby? Second line is NPO. Do not feed the baby. And second line, first thing immediately in your mind, in your question should come, what do I do when the child has TEF? No feeding. What position would be good? Upright position. Why? To prevent aspiration. So 2 things are very important. Then you go back on the top first line and keep the baby warm and make sure they have is enough humidified oxygenation, or if child is not maintaining, maybe child is kept in mechanical ventilator. But everyone should remember TEF baby, they have 3 C's and coughing, choking, cyanosis. They're drooling, so do not feed the baby, upright position. And they may give IV and child is prepared to go for surgery. But one thing they do before they do surgery, and I want you to underline the word G2. If in your question they're asking you, when do we use the G2 feeding here? Not before surgery. Why do they put the G2? Is to prevent aspiration and regurgitation. So underline the word minimizing regurgitation. And underneath you can add their aspiration. But they're not feeding the baby through the G-tube. And what they usually do it, they put the G-tube and they leave it open, and the G-tube is kept at the level of the stomach, and the air is going in, pushing what the baby swallow. But G-tube will be used after the surgery. Everyone is okay? When do we use the G-tube here? After the surgery, not before surgery. What is the purpose of having the G-tube here? To prevent aspiration and regurgitation. Let's go in the last line and highlight the word. Child come back after post-op care. You can start feeding is with sterile water, but G2 feeding would be used 5 to 7 days. What is your priority here? Is for baby pre and post, prevent aspiration and prevent from pneumonia. Are we okay? So everyone should know is number 2, very important in exam questions are, and everyone should know, esophageal atresia and tracheoesophageal fistula mean the esophagus is not completely open and food may be going into the lungs and you cannot feed the baby through the mouth. And what are the 3 C's are? Coughing, choking, cyanosis, and drooling, another one, continuous drooling. And what do? Keep the baby NPO. Everyone is okay? That's very important. All the wording for your exam that we must know. All the diseases I'm going to discuss are important. Next page, I will move on, is pyloric stenosis. We all know what is pyloric stenosis. We all know one word, projectile vomiting. And what does the baby has when they have pyloric stenosis? What is the meaning pyloric stenosis? Narrowing of the sphincter of the part of the stomach. And what part of the stomach is the pyloric, is the lower part of the stomach. Upper part is cardiac part, lower part is esophagus. Pyloric stenosis is the pyloric part of the stomach is narrow. And what happened? The milk is not going down. And what does the child does? They are vomiting. And what kind of vomiting is projectile vomiting? And underline that word, projectile vomiting. There are 2 words also you have. You can see peristalsis, but I want second one, very important, olive-shaped mass. Because the narrowing of the valve is there. So when you touch them, the stomach, you can feel the mass like a shape of olive. Are we clear? Everyone, 2 words are important here. What are the 2 words are important here? Projectile vomiting. And number 2, olive-shaped mass. And what happened when the child are vomiting? You got to correct here, they're going in metabolic alkalosis. So take out the word acidosis and add there is alkalosis. So when you have pyloric stenosis, they're going in metabolic alkalosis. And what else do you monitor the babies when they're vomiting? Dehydration and electrolytes. Everyone should know your question would be on dehydration. Now, when we are dehydrated, and if the child has moderate dehydration, and dehydration can say also is weight loss. So remember, when the child has that, alkalosis, weight loss is there. And also remember the word lights, electrolytes. 6% to 8% weight loss. If they have in the question, that means the child has moderate is what is that is called moderate weight loss, okay, and moderate dehydration. So what are you monitoring the babies when they have is pyloric stenosis, is dehydration, electrolytes, and weight loss. Are we clear? Now what would you be doing before surgery? What would you do before child is going for surgery is I want you to add their aspiration. What is the vomiting does? Aspiration. So your job is to prevent aspiration, maintain weight, monitor electrolytes, monitor for dehydration. Any question can be asked because we all know what do you look in vomiting. And after feeding, what is the best side we turn the babies? On the right side. So what side do we turn them? On the right side after feeding and prevent them from aspiration. Next is surgery. I like everyone recognize the wording. Pyloromyotomy or Fred Ramstead procedure is done, the name of surgery. Sometime in your question could be child is returning from Fred's surgery or pyloromyotomy. So you must know pyloro means pyloric wall, myotomy means is the repair. So name of surgery. What do you do after surgery? I want you to add there. When do you start feeding? So they have done is the surgery and feeding. When do you start after surgery the feeding? 4 to 6 hours. You can start feeding 4 to 6 hours, but what do you give the child here is electrolytes, no formula. Only electrolytes you can give them, glucose water you can give them, and after 24 hours, slowly you start the formula. Are we clear? Anytime when you start the feeding, you are not starting with the full formula and full feeding, but what do you start with? Glucose water or electrolytes fluid. So you can give them like Pedialyte, so you have more electrolytes. So that's important in pyloric stenosis. Gastroenteritis, I had it here. I know we all know what is gastroenteritis, but I want you to highlight one word here, is what is the main infection in the babies are, it caused by, underline the word, rotavirus. Rotavirus is causing, and salmonella, very important. Ingestion of sorbitol and fructose juice fluid can also lead to them. So rotavirus and salmonella is very important, is causing infection. And what do you give them when they have gastroenteritis? Again, IV fluid, Pedialyte is good, they're vomiting, and same thing you will monitor. But I had word here is bread diet. What is a bread diet is banana, rice, you can give applesauce, toast, and if you start the formula, you go with half strength and maybe soya formula, and then you go full strength. So bread diet, we all should know the wording. Rotavirus is important, and salmonella. A lot of question can be, what are the one of the reasons the child get the gastroenteritis, and answer would be your rotavirus. Next, I'm going to move on, intussusception. Intussusception, very important. We all know, and I know that you guys know very well about intussusception, but very important few things is here. Number one, remember, it's obstruction, and what happened here is telescope of portion of bowel into the other side. And what happened, it makes a telescope, and one part of the bowel goes into the other. So very important word, when you see the word telescope, immediately you know telescope means the one side of the bowel going into the other, and is causing is obstruction. Whereas common obstruction is, underline the word ileocecal valve. And where is ileocecal valve? Where we have large intestine and small intestine. They're meeting together and there's a valve. So what is the common area the child has a obstruction is called ileocecal valve. And what is the word I said? One word is called the word telescope. And it's obstruction. And what does the child has? Let's go in data collection. Is pain, like a colic pain. And when they are vomiting, in their vomit, what do they have? Bile, maybe fecal emesis, but the bile is very important. So a lot of bile you don't have. That means it's coming very higher. When you're going more lower, you're getting the bile coming out in the vomiting. That means the obstruction is little lower. So you have bile. And stool, what kind of stool the baby has is current jelly-like stool. But not only memorizing current jelly-like, I like it, we all should know, contains blood and mucus. There are a lot of questions I come across and they don't have current jelly-like. And they have what? What kind of stool you will see with mucus and blood. So I want everyone to know what kind of stool they have, current jelly-like with blood and mucus. Full thing we need to remember. And what do you feel in the second line? Sausage-shaped mass in the upper quadrant. And you will see in the sausage-shaped mass. So everyone should know they have a lot of pain and they have bile-stained vomiting. And what kind of stool they have? Current jelly-like stool with mucus and blood. What interventions are done? They have to do surgery. But before surgery, they can give them barium enema. So they may ask you, what is done for the child before? Yes, you're monitoring vomiting, dehydration, aspiration, anything. Remember, the question can be, because you know the child is vomiting, you got to prevent aspiration. All that answers are there. But what do they give them to open up the obstruction? Barium enema. So underline that. And why? To reduce obstruction. And it may open up the obstruction. And what is the function of barium enema is hydrostatic effect. Hydro means it absorbs the water and it helps them to open up the obstruction. Everyone, I'll tell you, we have to know the material. And what is in intussusception? First thing, remember the word telescope. Second thing, what kind of stool they have? Current jelly-like with mucus and blood. And what is the child is having a lot of pain and they have bile-containing vomiting. You're monitoring for dehydration, all that answers can be asked. But what is the main treatment is here is the barium enema. And how does barium enema works is by hydrostatic. What is hydrostatic? It absorbs the water. So everyone should know what kind of enema do we give when the child is having intussusception is the barium enema. Now I'm going to move on. The other disorders in the child is called Hirschsprung disease. What is Hirschsprung disease is, again, is obstruction. Another name is called megacolon. In the first line, it says congenital mega. Mega means large. Colon means at the part of the colon is enlarged and is called megacolon enlargement. But then you will hardly find the question when they're giving you megacolon, because if they give you megacolon, we know it's a colon problem. So most of the time in question, we have what is Hirschsprung disease is, the word would be more Hirschsprung disease. It's a megacolon. And what is the problem here? Underline the word. It's enlarged. If you look at the pictures, it's more colon is enlarged. Why? Because they're missing ganglion cell. So I want you to underline the word ganglion cells are missing. And where does it start? From the lower part. And where is the lower part? In the rectum. Where is it going? Upward. So everyone highlight the word ganglion and highlight the word rectum. And what does it cause the baby? Data collection. Failure to pass meconium. It is congenital problem. Child born couldn't pass the meconium. And they give you the question. Child, a failure to pass meconium, what are we looking for? Maybe for Hirschsprung disease. Are we clear? So Hirschsprung disease, again, obstruction. What's the problem here? Not able to pass the meconium. And they have abdomen is distended. They can't pass the BM. Underline the word failure to weight gain. They can eat and so they are not gaining weight. May lead to poor growth, second line, and vomiting. So a lot of question could be failure to pass meconium, poor growth, abdominal distension, failure to weight gain, sign of Hirschsprung disease. And child is still vomiting because it's obstruction, BM is not passing, so they are vomiting. And what kind of vomiting again is bile stain. So intussusception and Hirschsprung disease, both of them, they're vomiting, and both the disorders, they have bile stain vomiting. And what do you do? Foul smelling, the very important, the last word here, ribbon-like stool. So intussusception is different stool. We said current jelly-like. Here, Hirschsprung disease, what kind of BM the child is passing is more ribbon-like stool. And what would you do? Diagnosis. Rectal biopsy. They can do rectal biopsy or they can do barium enema. Now what do you do to prevent or to help the child here is fiber, fluids. You can give them. And also they can give enema. But what kind of enema they will give here? Underline the word normal saline. Non-isotonic fluid can lead to water intoxication. So they only use normal saline here. And what do you monitor a child here again? Fluid and electrolytes. They're vomiting. What is the treatment here? Is a permanent problem here. So they have to do is temporary colostomy. And when the other surgery, immediately surgery would be done, temporary colostomy. And when the child gains weight, now underline the word pull-through surgery. They're doing the final surgery when the child gains about 20 pounds. Check the abdominal girth. Avoid taking rectal temperature on the child, and maybe child has NG tube suction. Why do we have NG tube suction? To remove the fluid and to keep the stomach distension lower. So why? Because they can have distension. Let me repeat, everyone needs to know in a right way, and every single word is important. So what is hairspring disease is congenital megacolon, another word. What are they missing here? Ganglion cells. Are we clear? And where does it start? From the rectum and going to the colon. What is the problem with the babies are here? They're born, newborn babies not able to pass the meconium. They have abdominal distension, they're vomiting, they're losing weight, and what kind of stool they have? Ribbon-like stool. And how do you diagnose them? Is by biopsy. And maybe they can give them barium enema. And how do you treat them? Is by giving normal saline, enema, and also you got to give them fluid, IV fluid maybe, you can give them fiber. But what is the main thing would be done here? Surgery. And what is surgery is done is called temporary colostomy, and because you got to do immediately. But when the child gains weight, then they're going to do is the final surgery, which is called pull-through surgery when the child gains the weight. So that's about the hairspring disease. Next page, we'll move on, is the next disorder is PKU, which is called phenylketonuria. Very important, we know in the babies, they're born with PKU problem. It's underline the word genetic. It's a genetic disorder, and where does it damage if the PKU level is high? Underline the word CNS, central nervous system. And I want you to add there, what does it lead to is leading into mental retardation. What is CNS depression is, it's affecting central nervous system, and write down the word, maybe in your question, what can it happen to the child? It affect their mental retardation, mental disorder. And it's a toxic level of phenylalanine in the blood. So what are we checking in PKU? Underline the word phenylalanine level. In the second line is normal is less than 2 mg. And if it is more than 8 mg is high. And the third line, irreversible brain damage, means mental retardation. And all 50 states, we required all the newborn babies must be screened for PKU. So all newborn babies must be screened. A lot of questions is what test is done is called in the next line, Guthrie test. So highlight that word. What is the blood test is done here? Guthrie test. And where do you take the blood? On the baby's heel. When do you do this blood test? Not right away when the baby is born. Underline the word first week of life. Maybe in the 2 days, 3 days, and maybe in your question are when the baby has enough protein. Are we clear? So that means baby must take the formula or mother's breastfeeding. You don't do right away as soon as baby is born. Everyone should know this question, and these are very important. The PKU is important in all 50 states to screen the babies, because why? If you don't screen them and baby has phenylalanine level high, it can lead to mental retardation or irreversible brain damage. What is the test name is called is the Guthrie test. Where do we draw the blood? Where do we take the blood from the heel of the baby? When do you take them? Not right away. You got to give them at least 3 to 4 days, first maybe in first week of life, not right away. That's number first answer. Never pick up on that. Baby must take it enough breastfeeding or formula so we can see if they have any problem. And if the PKU level is high, what does it cause? It causes, in your data collection, vomiting, seizure, underlying, and psychotic behavior. It's going to affect the mind. So if it's positive, and you got to be sure the baby is not affected, and we are cutting down with the feeding. And what is the treatment would be? Now, low phenylalanine diet. And underline the word special formula is available, and it's called Lofnilec and Pro-Free Total, which is in your package, and you'll highlight that, is Lofnilec and Pro-Free formula, which is available, and you can give them everything, cereal, fruits, vegetable, but underline the word, what do you avoid the babies? Highlight there, high protein diet. So what are we cutting down here? Protein. And second word is artificial sweetener because it contains the aspartame. If mother allowed breastfeeding, they got to check the phenylalanine level closely because it may contain, but sometimes the level is very low. Maybe mother is allowed to feed the baby, and if they did, you got to monitor the level frequently. Everyone must know PKU, very important. And what is PKU is the blood test name and why we need to do it to prevent mental retardation or irreversible brain damage. And what diet do you give them? If it is positive, you cut down the protein. So everyone, make sure we highlight the right wording. Next word, I'm going to move on, celiac disease. Now what is celiac disease is, highlight the word gluten. We got to cut down the gluten in the diet. It's causing induced enteropathy, means it's affecting the stomach. And so main wording gluten. We got to cut down the gluten in the diet. Second line, highlight the word malabsorption. So what happened is malabsorption in the small intestine caused by intolerance of gluten. So what is the problem here? Intolerance of gluten in the diet. And gluten is found where? In wheat, oat, and barley and rye. And some of the book has the word broad, B-R-O-W, barley, rye, oat, and wheat. So you can add the word. And so your questions are going to be on celiac disease about the diet. So what is the child is here is gluten is the diet and intolerance of gluten. That's the main wording. What do you avoid? You remember the word B-R-O-W, barley, rye, oats, and wheat. Anything in the wheat, anything with barley and rye, all those in the diet. So it's a diet question. Again, data collection are what happened to the babies if they are taking gluten and they can tolerate is causing steatopyria, fatty stool. That is the word, steatopyria, fatty stool. And abdominal distension. Muscle wasting. Child is losing a lot of fluid, leading dehydration, diarrhea, pale color, odor, very bad odor. So remember, what is the main problem? Child is not tolerating and they're having a diarrhea. And it's offensive, the bad smelling, steatopyria. And remember, when they're losing and they can't digest that, they're losing a lot of weight and muscle wasting. Odor is bad. Indigestion of gluten. If they keep on eating that gluten and indigestion, it can lead to celiac crisis. So if you see the word, what is celiac crisis? Profuse diarrhea and vomiting. And one word everyone should know, the wording is here, is what? Intolerance of gluten. Everyone is okay? Intolerance of gluten, very important. What diet do you avoid? Wheat, oat, barley, and rye. And what does it lead to? Crisis. If you don't know and you keep on giving that food containing, child is going into crisis. Everyone remember they're losing a lot of weight and the stool are very offensive, and what do they have in the stool is called a steatopyria, indigestion of fat. Intervention, diet, gluten-free diet. What do you give them? Gluten-free diet. Everything with what? Is anything in the gluten you avoid. That means is your wheat, oat, barley, and rice. Corn is okay. Anything made with corn. Anything made with rice. And millet is another part of the grain. Rice is okay. Corn, meal, you can correct that. Corn flakes. And you can give them lifelong. They cannot take is wheat, oat, and barley. And folic acid is important. Because they're not digesting fat, you got maybe in your answer in giving them fat-soluble vitamin, which is ADEK. So very important, folic acid can lead to them is a lot of vitamins deficiency and fat-soluble vitamin. Support with the Celiac Sprouts Association for the parents to support them. So everyone should know is anything with the wheat, you're not going to be cream of wheat, any buns in the hamburgers, they can't eat with the wheat bread. So remember all your diet questions. Celiac disease, very high in the exam, very high in your question. Everything what I'm talking to you, we must know where does what answer fit in. When they're talking PKU, is totally different, is protein. When we are going in celiac disease here, what are we taking away is gluten in the diet. Are we clear? And what can you give? Anything with corn, rice, nothing with the gluten, oat, and barley, because that can cause is more crisis. And what is the word is crisis? They're losing a lot of, they're having a severe diarrhea and vomiting. Next is, I have a word here, fever. The purpose is here, we all know what fever is. But what is in fever is dehydration. Second line, diaphoresis is very important. And remember, when you're diaphoresis, you're losing a lot of fluid. And intervention, a lot of question can be, give a sponge bath. Because when you have fever, but never take a cold water. What water is good for the babies here? Last line, lukewarm water. Are we clear? So in your dehydration question for the babies are, now we know that take a cold water, but what is the best is you don't want to use a lot of cold water, go on lukewarm water. And how long? You can continue 20 to 30 minutes. And what do you monitor in your fever question always? Dehydration. And what is dehydration leads to? What does dehydration leads to? Hypovolemic shock. Your signs and symptoms are going to be tachycardia. And remember, is low blood pressure. So I want everyone write down the word shock. So you remember the symptom of shocks is low blood pressure, pulse is high, respiration is high. So connect our question. Child is having fever, leading diaphoresis, leading dehydration. What are you monitoring? Shock. When you're giving a sponge bath, go on a answer with the lukewarm and monitor electrolytes. Vomiting is again, is for child when they're vomiting here is prevent aspiration. Alkalosis, airway is important, and aspiration, and always turn them on the side. Now next page you have the same information, so we can cross it out and go on the other page is diarrhea. In diarrhea, when you're losing fluid, is called metabolic acidosis. Anytime in question with child diarrhea, very important is isolation. goes in the last word, enteric. Enteric means something wrong with the stomach, GI system. And what isolation are you maintaining or precaution? And where does enteric isolation goes in contact isolation? So write down the word contact. And remember, hand washing is number one, our priority. Omphalocele. Next is congenital defect in the babies are omphalocele. What is omphalocele? Word here is hernia. Herniation of abdominal content. What is hernia? Means organs are coming out. Are we clear? So what is omphalocele? If they give you a question and you're looking, what is omphalocele is? Hernia of abdominal content where? Umbilical ring. So we all know this is area, we have umbilicus area and newborn baby, those who are born, and the organs are popping out where? From umbilicus area. Are we clear? So that is called omphalocele. But underline the word when it's saying is they're coming out, underline intact, second line, with peritoneal sac. So meaning is, when the organs are coming out, they're not loose. They have a sac. Are we clear? So what is omphalocele are? Organs are coming out, but these organs are where? At umbilical area. And it's umbilical ring, we call. And what is they are? They're covered with the sac. So they're all together, they're safe, but they are popping out. And that is called omphalocele. Everyone is all right? What is omphalocele is? Hernia of the organ, that means intestine, through the umbilical ring. But remember one word, they have covered by sac. That's important. And what do you do? Is line 3. Protrusion, protrusion means coming out with translucent, you can see through a sac and containing bowel. And very important, next thing, prevent rupture of the sac can happen with evisceration. Remember the word dehiscence and evisceration. What is evisceration? Popping out the organs. Are we clear? And what can it lead to? Rupture. And also to prevent rupture, what can we do here? Child may need gastric decompression. What is the word gastric decompression? Is NG tube with suction. So they're removing the stomach fluid. What happens if the stomach is full? The pressure is more. So what is the two things we do? We put NG tube to feed, but when you want the stomach to rest and not to bloat too much, what do we do? NG tube suction. What is another word for suction is called decompression. So wherever you see the wording, decompression means is what? They're compressing, decompressing the stomach by removing the fluid. So patient has NG tube with suction. Wording is important. Decompression. What are we doing? Keeping the stomach empty. What will happen if the stomach is too full? Is going to be popping out more. So what are we preventing here? Rupture. What do you do in the next line? Prevent distension. Visceral organs distension. Underline next is what would you do as a nurse? Again, cover with normal saline gauze and prevent them from drying. So two things we remember here. We are preventing the abdominal distension. And what are we preventing here? Drying of the sac. So what do we do here? Decompression. We have the NG tube and taking out the stomach fluid intermittently, and you cover the sac with normal saline. And number 2, next is they can keep the baby NPO, prevent the rupture of the sac, and frequent manual reduction. Because it's in the sac, and they can, manual means by hand. They can push it back. Now, a lot of time hernia, you can push it back and they can go back safely, but they still have to do the surgery. But they may be able to push it back and keep it covered with normal saline, suction, and child will go for surgery. Are we clear? So what is the word is omphalocele? Everyone is okay? Where is the organs are coming out? Through the umbilical area, and it's called umbilical ring. And what is main thing I said here, make sure we know it's covered with what? Sac. What do you do as a nurse? Preventing drying of the sac, so you covered it, and preventing rupture. And why? And what would you do to prevent rupture? You are keeping the stomach empty. And what do we do here? Decompression. What is the meaning decompression is here is NG tube suction. So that covers your omphalocele. Next word, I'm moving on page number 4, gastroschious. What is the word is gastroschious? Same. Hernia, and usually on the right side to the umbilical ring. Same thing. This is also hernia at the umbilical ring, but there is one difference. Underline the word, there is no membrane. It's not covered. An exposed bowel. You can see all those intestines are loose. So what is the difference here is gastroschious has no covering. Everyone is all right. And then what do you cover here? Cover loosely, covered with saline soap and pads abdomen, and wrap in what? Plastic. That's very important. Why? If you don't use the plastic, the gauze will stick to the area because there is no covering. So remember, if you're picking up your answer, and you do have a lot of questions in Saunders' book, a lot of questions on Peds, and you will come across those questions. And if you have gastroschious and don't pick up, just cover with normal saline, remember the word here, plastic. Why? You're preventing the sticking of the gauze. And what would you be done? Gastric decompression to prevent, underline the word, distension. Surgery will be done immediately within few hours after the birth because it is an emergency and there is no covering. Post-op care, child come back, IV, mechanical ventilation, monitor for the suture line, and monitor the baby for post-op care. Are we okay? Everyone is all right? Omphalocele and gastroschious goes where? In the umbilical area. What is the difference in gastroschious is, I'm repeating, there is no covering and all the intestine, they are loose. So when you are covering, you make sure you have the word plastic. Why? Because you don't want that, the gauze to stick. What is the word hernia in abdomen? Hernia word is protrusion. Anytime when you see organs are popping out, that's hernia. And hernia is opening in the abdominal opening wall. And there are two kinds of hernia in the babies. You will see in umbilical area. You have seen some of the babies has the little popping out there, and sometimes it can be inguinal in a groin area. So what are the two kinds of hernias are common? Umbilicus and umbilical and inguinal. What is the word hydrocele here? When you see question on hydrocele, mean there is a fluid where in scrotal sac, in the scrotum is full of fluid. And umbilical hernia in the data collection can be reducible. Reducible means you can push it back. Inguinal hernia is also you can push it back. But when does it get worse? And swelling can be reducible, disappear on rest, but when the baby cry and or coughing, the hernia would be more common because it's a pressure. So pressure, coughing, and any pressure can cause hernia to pop out, and you can push it back. Later on, they can do the surgery. So everyone should know the wording with hernia. Next page is you have incarcerated hernia. Incarcerated word is not good. In your question, anytime when you are going to see incarcerated hernia, and I want you to add there, is called strangulated hernia. So if they give you strangulated or incarcerated hernia, so make sure we add is also a strangulated hernia. It's about same, but this is not very is common one is if you do have in question, you can push it back. So what is strangulated hernia are they have a lot of pain and child is vomiting, you can add there, and also is tightly portion of bowel. So whatever the part of the bowels are there, they are caught in the hernia, and what is it compromising? So what is strangulated, incarcerated hernia? What are you monitoring? Underline the word compromising the blood supply. Are we clear? You can push it back. Why? Because they're twisted and they're not straight. You can push it back. Is incarcerated or strangulated hernia. What are you monitoring? Are underlying circulation, compromising circulation, because they're twisted and descended and tightly, they're caught in there. And emergency. Your answer would be incarcerated, strangulated hernia is you're compromising circulation. Child is going for emergency treatment for repair and monitor for distension. Another word is non-communication hydrocele. What is the meaning non-communication? Hydrocele means fluid, and underline the word is peritoneal fluid is trapped, but underline the word when they're saying non-communication, no communication with peritoneal cavity. And it's okay. It's usually disappear by age 1 year. So child goes 1 year of age, it disappears, and the word is called non-communicating. We already said hydrocele is the fluid around in the scrotal sac. But what is non-communicating has no connection with abdominal cavity. What is communicating hydrocele? In the second one, hernia is open from the scrotum to the abdominal cavity. Are we clear? So this one has abdominal cavity, bulging in inguinal area and scrotal area, and increases with the crying. So non-communicating means has no communication with peritoneal. Communicating means yes, is causing communication with the peritoneal, and the surgery would be done. And post-op care, what do you do after hydrocele? Questions is underline the word monitor for infection and hydration. And very important, after surgery on hydrocele, questions are ice bag and elevating the scrotal area. So highlight that word and avoid tub bath and incisional area and avoid sternus exercise. Any question after hydrocele surgery what do you use it? The word is using the ice and scrotal support, and avoid the tub bath and avoid is the sternus exercise. On that is so hydrocele repair is done. We talked about hydrocele is the fluid, and there are two kinds of hydrocele. We said communicating and non-communicating. Any question after hydrocele surgery, what do you do? Elevating the scrotal area, ice is good, avoid exercise, avoid tub bath. Very important that we all know the wording. And what did I said on incarcerated and strangulated hernia? Immediate repair. Why? Because compromising circulation. Page number 5. On page number 5 we are on is dehydration question. And what is dehydration? Signs are underline mucous membrane. We all know we check the mucous membrane. It's dry. Eyes, sunken eyes. Underline the word fontanelles are depressed. And also urine output. Everyone remember, you're looking on your babies in adult, everyone, and especially in the babies, got to check with the mother how many times you have changed the diaper, because you want to know how many time is changing diaper means if you're changing, baby is hydrated. If you haven't changed the diaper, that means baby is what? Dehydrated. And a lot of question can be color of urine in your adult. And what do you monitor when child is going in dehydration? Shock, and underline the word level of consciousness with dehydration and shock. Now, gastroesophageal reflex goes in the GI system with the babies, and gastroesophageal reflex we have in adult, but a little bit differences here in the babies here. If child has gastroesophageal reflex, the food is going upward, as we know, and gastric content are backflow of the stomach fluid into the esophagus. And what do you monitor child here? Underline, very important in the children with reflexes are GERD here, failure to thrive. And underline the weight gain. And very important, anemia. Because when the food is coming up, is causing irritation and can lead to bleeding and lead to hematemesis, vomiting the blood, maybe anemia. What do you keep in the room when they have is here with GERD, suction? Monitor the lung sounds if they aspirate after feeding. Infant position can be 30 degrees after feeding the babies, and prone position only when they are awake. More than 1 year of child, here you can turn them on the left side and head of the bed elevated. So here we have a little bit difference than the adult. In adult we just have one answer, raise the head of the bed. They're small children, and when they have, in some of your question would be also because when the children feel GERD problem, they don't want to eat. So as a parent or as a nurse, maybe question, what do you teach the parent? Consistency. Stay with the child when they're eating their meal. So consistency, stay with the child, you guys can add. And underline the word, thicken the formula. Anything you can thicken the formula for the small babies. And what do we use to thicken the formula is the rice powder. So you can mix that and rice cereal per 6 ounces of formula, 1 tablespoon. And avoid food, cause more irritation question. Chocolate, tomato product, carbonated beverages, spicy food. And avoid vigorous play and avoid feeding just before bedtime. That is also we have in adults. So very important GERD question, anemia, I would remind you, and also hematemesis word, failure to thrive. In the positioning is very important that you guys highlighted for infant and for little older children. Next is, I will move on page number 6 is CHF, congestive heart failure. What are the 3 things you will remember in CHF? Remember when we have done cardiac? And same thing is little kids, a little more different problem, but CHF is same. What is CHF is? What are, when you're looking the word CHF, congestive heart failure, what is the first sign we all need to remember is number 1, weight gain. Heart is not pumping. What are we retaining here? The fluid. So I want you write down the word weight gain, number 1. Any question in the child is admitted with CHF and child has gained weight. What do? Notify. Even 1 pound gain, and that in a day is for child is weight gain. And what do we do here? Notify. Remember in your question, that means they're getting bad. And number 2 is tachycardia. And number 3, I like, everyone memorize, is tachypnea. What is the meaning? Tachypnea, breathing problem, whether you have child or an adult. Everywhere we remember the word tachycardia, tachypnea. So in your mind, your questions are going to be what? Child is gaining weight. Maybe problem in breathing, keeping them upright position. So let's highlight the word weight gain, tachypnea, tachycardia. 3 words, very important. What do you monitor as a nurse intervention? 1 pound of weight gain, notify physician. Check the respiration, 1 full minute. And position, semi-foulers. What do you avoid here? Overfeeding. Same thing in adult. What do we restrict here? Fluid. You don't want overfeed. Why? They're already retaining a lot of fluid. So remember 1 word, do not overfeed the child. Give them rest in between. They cannot breathe easily. What do you monitor? The pulse. They're getting the cardiac medication, digoxin. Check the pulse rate. And apical pulse rate. Less than 90 for infant or young, hold it. Less than 70 for older children. What is the toxicity for digoxin R in the children? Vomiting. Highlight that. And bradycardia. So digoxin is given. Any question, child vomits the digoxin. Never repeat the dose. You got to wait for the next day. Mother calls you, any question, I gave digoxin, but I think child vomited and maybe vomited out a little bit digoxin. What do I do? We don't know how much. Are we clear? So we do not repeat the dose. And you got to wait next day, so your advice would be give them. How do you measure the medication for the children is not by teaspoon. Never pick up your answer teaspoon. You got to go with the syringe. We use the word needleless syringe. We have syringes for liquid medication. And what else do we use here? The dropper. You can use the dropper, and also we have the syringes comes with the liquid medication. And remember, wash them, clean them, and replace them as your policy, because you can cause infection. But use the same syringe for same medication. Each bottle has their own syringes. Are we okay? So everyone, congestive heart failure, weight gain question, notify. That's your number one answer. What do you monitor? Breathing. What do you cut down here? Overfeeding the child. What are we restricting here? The fluid. What is it they're retaining here? Is more fluid. Next is tetralogy of Fallot question. What is tetralogy of Fallot? I want you to write down congenital heart disease. And what do you see in the babies here are blue babies. What are these babies are? Blue. And what is the color? We call the word cyanotic. So write down the word cyanosis. And what are these babies are? They call the blue babies, cyanotic baby. And they have congenital heart problem. Remember, they have defects in the heart. The lungs, there is no circulation in lungs and liver when the babies are not born. After they are born, what happened? The lungs are open and they start circulating through the lungs and getting oxygen. But what happened? Those defects, they didn't close and the blood is not getting oxygenated. So what are they not getting? Lack of oxygen. What is tetralogy of Fallot? Are congenital heart problem. There are 4 defects we have. It's right underneath under tetralogy of Fallot. What are the 4 defects we have? Ventricular septal defect. We have 2 ventricles, right and left, and that septal defect is there. And pulmonary stenosis. Pulmonary stenosis means pulmonary artery. And where is pulmonary artery? Is in the heart. Where is the pulmonary artery in the heart is in the right ventricle. And what happened if is not, the blood is not going towards the lung, stenosis. And overriding of aorta. Where is aorta? Is in the left ventricle. Are we clear? So it's a problem. You're not getting enough oxygenated blood. And what does it lead to? Blood is back and forth going and leading right ventricular hypertrophy. So there are 4 defects the babies have. What are the 4 defects we have here? Ventricular septal defect, pulmonary stenosis, overriding aorta, and ventricular trophy, which is hypertrophy of the right ventricle. What are the signs of babies? So when you see question, child has tetralogy of Fallot, immediately you know there's a congenital defect. What is child is not getting enough oxygenation, and they are called what? Cyanotic baby or the blue babies. And what are the problem with the babies here is data collection. I want you to underline the word hypoxia and also fatigue with feeding. They have problem with feeding. I want you to highlight very much and circle that clubbing of finger. What do you see first thing with hypoxia in your patient? Anytime hypoxia, is clubbing of finger. These newborn babies are having congenital defect and they have tetralogy of Fallot and they have problem with what cyanosis. And what would you, if first sign they might say, what would you assess in the babies is the clubbing of finger. What is the baby is having here? Hypoxia. What is hypoxia? Lack of oxygen. And what is hypoxia would make you? What do you feel when you have lack of oxygen or you have anemia? You get tired easily. You can function. So child is getting fatigued with feeding. Mother brings the baby and mother says, when I'm feeding my child goes to sleep. He takes only very little milk. You cannot do any exercise. Child cannot even drink the formula or the breastfeeding. Why? Because they get very tired. And what will happen to the child? They start losing weight. So what is the first indication in your questions are, child get tired during feeding time. That means they have some problem. And clubbing of finger. Hypoxia, lack of oxygen. And what does it affect the child? Growth and development. They're low with the weight, they're not growing as the normal child are, and they get very tired. Treatment, what do you do if they give you a question, child has hypertonic spell, or they use the word TET spell. I want you to write down sometime, they use the word TET. TET means tetralogy of Fallot. Spell. That means they become blue. What would you do when they have hypertonic or TET spell? Babies are, or cyanotic spell. They use the word cyanotic, they become blue. What do you do? Turn the baby, 4 answers are here. Knee chest position, give the child 100% oxygen by mask. Morphine to relax the child and pain, and IV fluids. That means let them rest. So 4th thing everyone should know, tetralogy of Fallot. What is the treatment would be on the child would be? Surgery. They have to do the surgery and repair. Any question, child has cardiac surgery, child is going home, what would you teach the mother? Play outside. Omit playing outside. Child is old enough, but don't let them go out. Risk for more infection, so you don't want them. Avoid exercising or going on the bike for 2 to 4 weeks. And if they're going school, on 3rd week, only half-day school, not a full day. So remember, they start slowly exercising because you don't want them to do a lot of exercise. Avoid immunization. Any immunization can be avoided and until you check with the doctor. And most of the time, your question would be live vaccination or live immunization. Dental visit for 2 months, avoid because any infection can affect the heart. So you don't want any kind of procedure. No physical education for 2 months in the school. Do not introduce new food because of allergies, and follow-up appointment after 2 weeks. So everyone, there is a restriction. You avoid them. So those are some part in your teaching questions are follow-up appointment you always is going to be. You're going to restrict the activity because child has a cardiac surgery. You want to prevent them from infection. So all that can help us in preventing the child from infection. Now, I think we should take a break before I start into rheumatic fever, and we